All right. Welcome everybody to Medical Mondays. So I'm gonna let everybody get a chance to log in. So we got on a couple minutes late. We're gonna let everybody log in. Um, Again, this is the 901 Strong campaign, making sure everybody is plugged in and engaged during this time and informed. We want to make sure everybody's informed while everybody's at home to know what's going on, know how we're progressing. And so we wanted to make sure you got an opportunity to talk to a medical professional that's on the front lines. And so we're going to have Kimberly Marsh come online with us, but I want to make sure I give everybody a chance to get online. And so I'm letting people log in and some watch parties kick off and see some people log in. Uh, so let that happen. Got that. Good stuff. So I see a few people jumping in. Good stuff. Awesome. Let's give people a chance to log in for a second. All right. Good stuff. I'm trying to make sure I talk to everybody that's on there. Okay. So I see Nikki jumped on. What's going on with you, Nikki? Okay, got it. Making sure I bring some other people online as well. Awesome. We'll get started in just a second. Good stuff. Good stuff. Let me see. Get my own little watch party kicked off. We will be ready to go. All right. Everybody to medical. So we got a few people online. We should be ready to go. Got it. So Maria jumped on. How's it going, Maria? How you doing, Brian? Thanks for joining in. Appreciate that. Good to go. Okay. So we'll kick it off. So again, the point of our Medical Mondays is to make sure we keep everybody informed of what's going on the front lines here in Shelby County with COVID-19, and to make sure that people are informed and getting information. And so we're going to do this every Monday so that people can get a sneak peek of what's going on the front lines. And so I got guest is going to be with us, a good friend of mine, Kimberly Marsh. She is a quadruple board certified um, uh, doctor here in the medical community, and is really an awesome jewel we have here. So I'm going to bring her in and welcome her. How are you doing over there, Kimberly?
I'm good. Thanks for having me.
No, thanks for being here. Thanks for being here. Glad to have you here. So I'll start off and just say, tell us a little bit about how you got into medicine. And I know you work over at Mid-South Pulmonary. So tell us a little bit about what got you into medicine and about your practice and your colleagues over at Mid-South Pulmonary.
Yeah, so I kind of had a roundabout way. After undergrad, I joined Teach for America for a few years, did that in Charlotte, North Carolina. After that, decided that I kind of wanted to work through the medical field to kind of give back that way. So went to medical school, and after that I ended up here for residency and fellowship. I did an internal medicine and pediatrics residency, and then pulmonary critical care, which is basically like ICU and lung medicine fellowship. And I finished last June, so I joined Mid-South Pulmonary in August, and I've been there kind of ever since.
Awesome. So the pulmonary obviously comes in handy at this point, and I'm sure you guys' practice, actually this comes up a lot because you are obviously this is an upper respiratory disease that affects people in that way, and so I'm glad to have somebody who knows a little bit about this specific area of the body and what's going on to talk to us. The first question I want to ask is, I know that you have your practice, but also that you guys all work in hospitals. All the doctors in the practice work in different hospitals.
Right.
And so I know you're out there during the week. So tell me a little bit about just what it's like in a hospital for some of us who are at home and don't know what's going on there. Just kind of what the protocols are there, what are people experiencing there, and what does it look like for you guys that are practicing in the hospitals right now?
Yeah, so my group covers the majority of the ICUs throughout the different hospitals in Memphis, as well as the pulmonary part, which is more just kind of assisting the hospitalists with, lung problems and their patients who aren't in the ICU. So, as far as COVID, it's kind of started to ramp up for us over the past week. Starting kind of the end of last week, we started to see more patients who are coming in and testing positive. We're also testing a lot more people, so that's great. The hospitals have done a lot to kind of streamline that and make everyone there safe. There's specific units for people who are being tested and for people who are positive, who are being treated in the hospital for this. And, they've just facilitated a lot of different ways, from everything from, rapid testing to the transport of patients who are suspected to potentially have this, just to kind of minimize contact and, contain the spread as much as we can.
Awesome. So I know the drive-through testing sections are to make sure that people are separated, because obviously isolation, social isolation is important. If you're social isolating, obviously you want to make sure you do it if you think you have symptoms. And so talk about kind of how the hospitals are set up right now. I know we discussed that a little bit, but where people are coming in, interests and things like that, and maybe the protocols as people come into the hospital.
Yeah, so they've really shut down to a minimum number of entrances in each hospital. When you come into the hospital, you're asked a series of questions by someone who's screening. Obviously, have you had contact with anyone who's known to have the virus over the past few days? Have you had fever, chills, any symptoms that are concerning? And then they do a temperature screen of everyone who's coming in. So if you pass that, you can go through. If there's anything alarming or that kind of sets off, a warning sign, then you're triaged further. And that's for, visitors and patients alike. So, if you're a patient who comes in and you suspect that you have or that you could have been exposed to COVID, you have some of these symptoms. So basically you're kind of fast-tracked and streamlined into a more secure quarantined area with minimum contact, with, everyone who comes in and out is wearing PPE. You're tested, and then you're kind of triaged as to whether, you're well enough to go home, or, you need to kind of be admitted to kind of wait for the test results and see what goes on.
Sure. One thing that I think is mentioned is I've heard a lot of people say is they kind of want to stay away from the hospitals right now because of everything that's going on. But obviously, there's a normal strain of people that are sick, that need medical treatment, and that need to be seen. And so can you talk a little bit about, if you're sick, like, I want to make sure that people are still going to the hospital and people are still being treated. So talk a little bit about that.
Yeah, definitely. So, overall, it seems like our hospital numbers are down. And I think there is probably an element of fear of being exposed to this if you come to an emergency room. But we want you to know that if you're sick, if you need treatment, feel safe, feel good about coming in. We're taking all the precautions we can, from, like I said, the isolation to the specific places where admitting people to minimize the spread. And so we want to, just encourage anybody who's sick with anything else to still seek out care and to feel safe in doing so. We've really implemented a lot of policies and procedures in the hospital to, continue to care for our regular patients who need us while managing this pandemic at the same time.
Right. And, I think that's an interesting point. I think, first of all, when the governor issued the order, the safer at home order a few weeks back, before the actual final order, a lot of, kind of elective medical procedures were put on hold. I know I went to the dentist and they said, we're not doing any cleanings or anything like that, only actually emergent in need medical procedures. But I think a lot of people might say, well, I don't feel that sick, so I'm not going to go to the hospital. And like, that's the worst thing you can do, not only because it can quicken whatever that is that's hurting you, but it can also break down your immune system. So if you were to come into contact with it, you're more susceptible. And so I think that's a good thing to bring in line. Like, yes, if it's an elective surgery that you don't need or something you want to put off, that makes sense. But let your doctor make that call. And if you feel bad, contact your doctor, see what they suggest for you. And if it's serious enough to go to a doctor's office, go to a hospital, please do that to make sure you're taken care of.
Yeah, and that's a really good point. I mean, if it's just, your yearly or your 6-month checkup and all you need is medication refills, then that could be something that could potentially be put off. But again, I know at least our office, but a lot of offices around the city have also implemented a telehealth component to their treatment. So, if you're not feeling well and you don't want to go to the office, but you're not sure if you should go to the emergency department or go to the hospital, you can always call your doctor and see if they have that option for telehealth, because a lot of people are offering that. And then you can speak directly to your physician or another physician who can kind of guide you on what you need to do. If they recommend that you should go seek further treatment at the ER, or they could potentially, help you out with your symptoms. But that's an option that's readily available across the city.
And so when you say telehealth, I'm just want to be very clear, because we want to make sure we get good instructions to everybody. So you're saying if you're sick, call your doctor's office, whoever your primary care physician is, or if unfortunately, and this is something we're fighting for, the 901Strong campaign, a lot of people don't have health care, but contact doctor's office, contact a hospital, tell them what your symptoms are, and try to identify, is there a telehealth or a way they can do it on the phone, online to diagnose you, and let the doctors and the hospitals make that decision.
Yeah, definitely. I know the way it's working for our clinic specifically is if someone had an appointment, they're not feeling well, they're not sure what to do, they have the option, to telehealth, basically to conference with us face to face to get some recommendations. And I know just from some of my colleagues around the city that a lot of primary care centers are offering this as well.
Okay, that's awesome here. That's awesome here. To step back a bit, to get into testing, I know there's been some consternation, and if I remember the facts, and I think we put in the infographic in the past, that in the Shelby County infographic, that the hospitals, they are operating no appointment necessary. So I think Baptists and Methodists are both saying, if you think you're here, come to the hospital, we'll take care of you. Or Christ community, the health clinics, or are asking for some appointments potentially. I know for some people,
do up to 200 people a day.
It's good to hear. It's awesome to hear. Good.
Definitely. And it's only one location. Hopefully, that in the future we can kind of expand that, because we do need to serve more parts of town. The UT at Tiger Lane also is testing people every day. There's a phone number that you can text COVID to, and they'll basically text you back a questionnaire, and you fill it out. And if they think that warrants further testing, then they'll give you an appointment to come there and get tested as well.
Super dope. So I got a shout out for the education people. I know prior to you getting an education, you were a TFA alum, and so you put out this information like a seasoned teacher to make sure everybody understands it. So that's awesome. I appreciate that.
I got that number. Yeah,
exactly. So shout out to educators. As an educator myself, so shout out to what you do. Shout out my friend Christine up in Philly. She's like, yeah, she's TFA. I'm like, yep. We got the whole thing. We got the whole thing online here. So I wanted to pull up a couple of graphics to look at it. I think the first graphic I want to pull up is the cumulative case count to see, so people can see kind of where we are just for Shelby County. Look at that a little bit. And so that cumulative case count is, take a second to pull that graphic up. And I think that should be up. So hold on, make sure that's up. I think people should be looking at it. I know we got the delay on the screen and everything, so. Okay, so looking at that graph, obviously, we started off with the one test in 3 and 4, and then you see it go up to where, the beginning of this month, last week we hit, went over 600, and you saw some jumps there. And I think, for a lot of people, there's a lot of fear going on looking at a graphic like that, because it's like, hey, man, it's going to keep climbing. And that is what's expected. But I think a lot of it also is a function of testing, right? And so what you just mentioned with the 200 tests, the capability of doing the 200 tests today, I think is huge. Shelby County has actually tested a pretty large amount of people. I think we're in like 14 or 15, like 40 or 50,000 that we've done tests. So obviously we want to make sure we have more tests and it's touching more people. But I think this graph is a demonstration of the testing demonstrated that this was out here. This was
is the projections that have come out, for the whole United States, and then you can stratify by individual state.
No, that's super dope. And so, we'll do definitely, we'll put something up just so people can look at that healthdata.org. That's a great way to look at it and be able to look at other places.
Right. And I think it'll provide people with a lot of reassurance that, one, that what we're doing is actually helping. Social isolation is making a difference. I know people probably don't feel like it is, but it shows you that what we did 10 days ago is actually helping us now. Even today, they said the projections of the peak date is like 4 days earlier in Tennessee than they thought it was going to be originally. And they attributed that to the fact that more people are staying home. So it's good.
Super dope, super dope. Yeah. And so I think that's huge. In addition to that, let me correct what I said. I think total tests we've done, I think in the state of Tennessee has reached like 40,000, but in Shelby County specifically, we're close to 9,000 or yesterday it was not 8,900. So we're definitely over 9,000 a day, and they're continuing to test. And so that's a good thing, that we're continuing to move that forward. But obviously as people we'll make sure. And also we've talked about, as we expand the testing, that there's going to be, to the Shelby County by age graphic. And that's one I wanted to look at because I think this is super important. And there are some disheartening news on here for millennials and Generation Z. I got to make sure we separate because I'm one of the older millennials, and so millennials are like 40 now. We got mortgages, and people forget what the millennials have like grown up over the past 10 years, and we have this Generation Z that's in the early 20s. So looking at the COVID cases by age for Shelby County that came up yesterday, I'll pull it up in just a second. Make sure that it is up. Okay. So for this one, interestingly enough, you see the highest group is at 21 to 30 group. And that is disheartening because unfortunately, let me be clear, and this is information I'd like for you to expand on it, but I think was pretty well established at this point is anybody at any age can succumb to death based off of being exposed to this virus, right? Obviously, there are some people that are more susceptible, but anybody can. And I think a lot of younger people early on, when we didn't know as much about it, thought, hey, I'm not, immunocompromised. what's in your bank account. Like it can affect everybody, and we can see that this is hitting different parts of the county in different ways. But ultimately, it's a team effort to ensure that obviously we get through this together.
Mm-hmm. Yeah, I agree. I mean, I think expanding testing locations, like you said, is the key to one thing, because then people will be able to access healthcare quicker if they know that they might have been exposed. And just things, more social measures that can be put in place to allow people who live in those communities not to have to go to work every day, to be able to stay home and shelter rather than have to go out and work or find food or things like that. So I think there's a lot of things that need to be addressed there, for
No,
sure.
definitely. And it's kind of a teaser for my town hall that's coming up on Wednesday. We're going to get some insight from somebody that's actually in Italy right now. So
Yeah.
a connection with somebody that's in Italy that's being impacted, that's been now they're in their approaching their 6th week of being in quarantine as a family. And so my there every day, but the medical for the sharing information. So thanks for telling everything. And so any kind of wrap up, close up things that you want to just points you want to hit home for the people that are still listening or that pick this up a little bit later.
Well, just I appreciate this, and just to hit on that real quick. There's a lot of unnamed people who work in the hospital every day, specifically our environmental services people and other people behind, the scenes who aren't recognized, but they're there every day helping us out. And those people really deserve to be recognized. I mean, they're integral to patient care and helping us out, and they're not working under the best conditions, and it's just they're so helpful and deserve all the recognition. But yeah, to sum up, stay at home. It's working.
Let's definitely stay at home. It's working. And if you are having medical issues, get in contact with your doctor. Let them make the call.
Correct. Don't be afraid to come to the hospital. It's safe. Do what you need to do to keep yourself healthy, despite what's going on, because